Hi, my name is Ahmad, and today I will be discussing how education can prevent the spread of HIV in women. First, I want to take the time to introduce myself. I'm a rising senior at Northwood High School. I play guitar in my free time and participate in the guitar programs provided at my school. I'm currently in the early stages of conducting research on computational psychiatry with Think Neuro Inc. I also took part in fundraising for the nonprofit organization Leukemia and Lymphoma Society. Without further ado, let's get into this presentation. In 2016, an estimated 2.4 million adolescent girls and young women made up 61% of all young people living with HIV globally. And in a 2015 study done by the World's Women's Study, about 781 million adults over the age of 15 estimated to be illiterate. 496 million were women. As a result, it is evident that roughly about two-thirds of young people who are HIV positive are women, and about the same percentage of people who make up the illiterate population are also women who are 15 and older. Now, is there a correlation or a cause and effect relationship between the two stats provided? Well, this question piqued my interest and ultimately motivated me to investigate this phenomenon. Here's our agenda. We will be going over what HIV is, why women seem to be more susceptible to HIV than men, why education isn't accessible for all, and then the what we can do or the conclusion I've come to. By the end of this presentation, I hope to inform you all about the importance of education and how it can prevent HIV. So, what is HIV? HIV is a virus that attacks CD4 cells within the immune system. CD4 cells play a critical role in protecting the body from infection. HIV multiplies and spreads throughout the body by utilizing the machinery of CD4 cells. The way this disease is spread is through certain bodily fluids like blood, semen, vaginal fluid, anal mucus, and breast milk. These bodily fluids can be transmitted from person to person by sharing a needle injection, engaging in unprotected sex, and breastfeeding. When HIV is left untreated, it can lead to AIDS. AIDS is typically a later stage of HIV, which happens when the immune system is badly damaged and is very vulnerable to infection. Unfortunately, there is no cure, but medication can help treat the disease. The goal of HIV treatment is to reduce as much HIV in the blood as possible. This is done through retroviral treatment, which is a combination of various medications that target different stages throughout the virus's life cycle. Without medication, people with AIDS only have a 3-year life expectancy. Here are tables I grabbed from AIDS Info, which shows the global HIV and AIDS estimates in 2021. The first row is devised by adults who are 15 and older, then as you go down the demographics of each group changes by sex and age. So these fact sheets reveal that women seem to be more susceptible to HIV and AIDS, but why? Well, there are many factors that play into these findings. Through a biological perspective, girls under the age of 17 have an underdeveloped cervix and low vaginal mucus production. Greater amounts of genital mucosa exposed to HIV are found in the underdeveloped cervix. From a sociocultural perspective, there are many other factors to consider, like how some societies do not provide information about reproductive rights or reproductive health services, how some societies only condone condom use for illicit purposes, how some societies marry off women when they are young, typically to a husband who is much older and experienced. This phenomenon is greatly influenced by laws and cultural norms that permit older men to have sex with younger girls. Women are taught to respect and never question their elders in accordance with these cultural norms. Due to those norms, it is uncommon to see situations where a woman demands the use of condoms during sexual activity or refuses to marry an older person. Poverty is another factor that needs to be taken into account because it increases the chances of women being coerced into unsafe sex. It seems that most developing countries suffer from high levels of poverty, and 90% of women who are affected by HIV are living in developing countries. I retrieved this stat from an article published in 1997 on PubMed, and although you may be thinking that the stat may be invalid because of how long ago it was sought out, I wouldn't come to that conclusion so quickly, because even though it may seem that poverty has been declining and we have been going at a better rate, we cannot ignore the COVID-19 crisis and how the number of people in extreme poverty rose from 70 million to more than 700 million people today. The world's poorest people are affected by the pandemic more than we think. Their income losses are twice as high as the world's richest. Additionally, the pandemic has had large setbacks on their health and education. So why don't these girls have access to education? Well, there are many reasons like legislations, policies, budgets that restrict a woman's right to education. Gender stereotypes also play a role as girls are frequently socialized to take on household and childcare duties because they are held with the expectation that they will be financially dependent on men. Another factor is a girl's financial situation. Since women's education is not prioritized due to parental biases towards boys' education, they are likely to drop out if costs become high. Most pregnant women are not given adequate support during their pregnancy or after giving births, and certain countries' laws forbid pregnant women from attending school for various reasons, like she is no longer a child, etc. So, what can we do? Well, we can advocate for the importance of women's education, remove any stigma that sex talks is bad, and we can prioritize funding schools in rural or poor areas in the world. In an article I read about the education vaccine against HIV, it mentioned the four S's. The four S's are shame, stigma, silence, and superstition. Education empowers women and gives them the skill to translate knowledge and make the necessary behavioral changes on their own, making it key to overcoming the four S's. Through promoting communication between women and men in all aspects, including sex, can bring the potential of changing cultural values, sexual norms, and practices, which can ultimately prevent HIV. Education can also raise a woman's economic and social status, which can decrease the likelihood of women being in risky situations that involve coercion of unsafe sex. Additionally, the higher the education is pursued, the higher their awareness of sexually transmitted diseases like HIV will increase. As a result, education increases the probability of making wiser decisions, which can stop the spread of HIV or at least lower it. I'd like to pull a quote by Elizabeth Taylor as she spoke out about the AIDS crisis. She said, "It is bad enough that people are dying of AIDS, but no one should die of ignorance. The voice of the poor and illiterate is unlikely to be heard once wealthy individuals do not see HIV as a problem to themselves." This quote demonstrates the need for us to take action for those who are not heard due to their current situation. That's about the end of my presentation. These are the references that I utilized. And I'd like to acknowledge my family who have been so supportive throughout this process, and I surely wouldn't be who I am without them by my side. I'd also like to thank Northwood High School staff as they've helped me through my academic career and shaped me for the hardworking student I am today. And lastly, I'd like to thank Johns Hopkins University for giving me this amazing opportunity to discuss serious global health issues here at our Global Health Leaders Conference. And audience, thank you for watching. Feel free to contact me with any questions, comments, or concerns. Thank you.